If you're watching this video, chances are you've been thinking about veneers for a long time, months, maybe even years, but you still haven't pulled the trigger yet. Why? Well, it's probably not because you're indecisive. It's probably because you're being careful. I see this all the time. Patients who've watched dozens of videos, compared dentists, gotten quotes, and still feel that hesitation in their gut. That hesitation, it's not because they're afraid of getting veneers. They're afraid of making the wrong decision. Hi, I'm Dr. Dougherty, a cosmetic dentist here in San Antonio, and in this video, I'll lay out all the biggest mistakes that cause people to regret their veneers, and most importantly, how to make sure you don't. Because you know what one unfortunate thing I see often is as a cosmetic dentist? It's patients who've already spent good money on veneers and still don't feel confident smiling. You see, most people think veneers are just about teeth, make them whiter, straighter, more even. And I get why. It's because that's typically what you see online. But your smile is so much more than that. It's your gums, your lips, your bite, and how all those work together with your face shape when you talk, laugh, and smile naturally. When patients come into my office here in San Antonio, I slow things down and look at the entire picture. Because if we skip that step and jump straight into veneers, I can guarantee your smile will get ruined. And here's why. The foundation is as important as the end results, which means if we don't cover all our bases, check the health of your gums, examine your bite, your veneers are set up to fail. Yes, they may look okay at first, but over time, trust me, you'll start noticing things. Uneven gum lines, discomfort while you're eating, even bulky teeth. That's exactly why I say the consultation matters more than the procedure itself. The procedure is kind of the easy part. The discussion and the decision process, those will make or break the final result. So, veneers may sound like a pretty straightforward solution, but getting there is going to be a long journey. But don't worry, you don't have to figure everything out on your own. I actually have an office here in San Antonio where you can book a consultation and we'll work together to figure out the best way to move forward. So if that sounds like something you want to explore, I put the link to schedule an appointment with me in the description box below. But for now, let's talk about something that a lot of people tend to forget when it comes to veneers. The issue isn't so much your new teeth, but your gums. Think of it like this. Your gums are the frame around your teeth. And just like a picture frame, if it's uneven, no matter what picture's inside, it's not gonna look quite right. Because even the most beautifully made veneers can look fake if the gums don't really line up. So if one tooth shows more gums than the others, or if the underlying tissue has some problems, your veneers may not improve your smile. That's why I make it a point to examine the gums first. And depending on what we find, the next step might not even be veneers at all. It could be gentle gum contouring or orthodontics. Other times, it could be simply just letting the tissue heal properly before moving forward. When gum issues are ignored, your veneers will be forced to compensate for problems they were never designed to fix. You have to remember, veneers will make you more confident in your smile, but they won't correct gum levels. They don't move teeth into better positions. And they can't possibly sit on what's already there if what's already there isn't ideal. That's why I tell patients, great veneers start below the tooth, not on top of it. And only once we set the foundation correctly can we move on to the next crucial step, which shouldn't be the permanent bonding yet. Because let me tell you, if your dentist places veneers on you before you see your new smile, that's a warning sign. Every face is different, and every smile moves differently. So what looks great on one person might look completely wrong on the other, even if the new set of teeth is technically perfect. That's why smile designs are so important. Patients need to see what the results could look like before anything permanent happens, which could be in the form of a digital mock-up, a wax-up, or even temporary teeth. These tools turn guesses into decisions, and they allow changes before anything permanent happens, so you know exactly what your smile will look like. So skipping this phase isn't just risky, it's expensive and emotionally frustrating. Just think about it. You might end up with teeth that are technically fine, but feel awkward, fake. Well, this smile design phase is your safety net. It ensures the veneers complement your unique facial structure, lips, and personality before anything is cemented on your teeth. That's why, before you make a commitment, ask yourself, have I seen my smile before the drilling starts? Am I happy with how I look? Because trust me, no matter how good your dentist is or how premium the materials are, your veneers will fail if they aren't designed first. And when I say design, I don't just mean aesthetics. I'm also referring to how your new smile works with the whole you. Because oftentimes people assume veneers are like ordering a pair of shoes online. They pick a style, they place an order, and somehow they expect a perfect smile will be delivered. Well, veneers aren't factory products. They're more like handmade works of art, and the people behind them matter just as much as the dentist placing them. Every veneer is crafted by a ceramist, an expert artist who shapes, colors, and textures every tooth to match your smile perfectly. In fact, it's possible for a patient to have veneers done elsewhere. The dentist could have done everything right on their end, but the lab rushed the work and barely communicated with them. The result, it would be flat, lifeless veneers that didn't reflect the patient's natural teeth whatsoever. The shape could be off, the shading dull, and the smile as a whole could lack so much personality. That's why I've built a 17-year relationship with a single top ceramist. By now, we understand each other's standards. We know each patient's expectations and communicate constantly during the entire process. So here's what I want you to remember. Even if your smile is designed perfectly, bad craftsmanship can ruin it. And no amount of digital mock-ups or wax-ups can fix veneers that were poorly made in the lab. That's why the long-term dentist-ceramist relationship matters. It's how we make sure the artistry, precision, and personality of each tooth survives from design to final bonding. So, if you want to reassure yourself that you're trusting your new smile to the right people, ask your provider, who's making my veneers? How long have you worked with them? And do they understand my smile as well as you do? Because at the end of the day, great veneers require great craftsmanship. Now, if you want to learn more about my process or how we build your veneers from start to finish, feel free to book a consultation with us. Again, the link's in the description below. Now here's a question I get all the time. Can I just get veneers on my front 4 teeth? And look, I understand why people ask this. You look in the mirror, you see those front teeth, and you think, that's all I need to fix. But here's the thing. The number of veneers you actually need has nothing to do with what you think needs fixing. And it has everything to do with what problems we're actually solving. Let me give you some examples from my practice here in San Antonio. I've done beautiful veneer cases that only required 4 veneers. I've also done some stunning transformations where I had to treat 20 teeth just to get the results right. So what's the difference? It all comes down to the problems we're addressing. If we need to widen your smile, we're talking 10 or more veneers. If we need to lift your bite to improve function or create room for bigger, more proportionate teeth, again, 10 or more veneers. If we need to dramatically change the color of your teeth, we might be looking at 20 or more veneers. But here's where 4 veneers can work beautifully. If your overall color is good, your tooth shape is good, your smile width is good, you've got room in your bite, and all we're doing is refining the shape and aesthetics of those front 4 teeth, then yes, sometimes we can get an amazing result, which is 4 veneers. The mistake happens when a patient says, I just don't like how my front 4 teeth look and I only want veneers on those 4. Then I examine their case and see all the problems I just described: narrow smile, worn bite, color mismatch, proportion issues. And if we only do 4 veneers in that situation, they're gonna look at the end result and wonder why it doesn't look right. Why their smile still feels off. Why those 4 perfect teeth somehow make everything else look worse. That's what happens when you ignore the real problems and make compromises just because you think the problem is small when actually it's really big. So here's what I want you to remember. Great veneers aren't about treating the teeth you want to change. They're about treating the teeth that need to change to solve your specific problems. And that's something only a skilled cosmetic dentist can determine after a proper evaluation, not something you can decide by looking in the mirror. And you know another way mismatches happen? It's by rushing the plan and making things fit after the fact. You see, every veneer needs a little space to sit properly, but removing too much enamel is permanent. Once it's gone, it won't grow back and it can't be replaced. So if a patient who's had veneers done by another dentist comes into my office in San Antonio complaining of sensitive teeth, it could be one of 2 things. 1, they did extensive enamel removal to straighten teeth when they could have been aligned conservatively with proper planning. And 2, there was an underlying issue that was never previously resolved. Either way, the only way to prevent this outcome is to follow conservative preparation, meaning the entire smile has to be carefully evaluated and planned first. From the gums to the bite, from the number of teeth to the overall design. Rushing through prep doesn't save time. Instead, it creates long-term problems. The slower, more deliberate cases, you know, the one that takes 6 visits over 2 months, are usually the ones that protect teeth and deliver natural, lasting results. That's why the key here is patience. Don't let anyone rush you into drilling before they've shown you a complete plan. And if they do pressure you to take action before getting the full picture, I suggest you look into a different provider. Because again, once your enamel's gone, it's gone forever. But honestly, most veneer disappointments don't come from the procedure itself. It comes from failing expectations. And maybe you know someone who's been on that boat before. Maybe they went to get veneers somewhere else, but then decided to consult another dentist because they hated the results, even when everything technically checked out. The teeth were straight, the color matched, and the craftsmanship was decent. But for some reason, they didn't like how their new teeth looked on them. And you wonder, why? It's possible that they probably expected a Hollywood perfect smile, and what they got, while clinically excellent, wasn't what they envisioned. That's why communication is everything. So before I even prep a tooth, I spend time making sure my patients understand what veneers can do, what veneers cannot do, what compromises are necessary, and sometimes the right answer is to pause or even decline treatment until the patient fully understands what's involved. Ultimately, saying no doesn't mean failure. It's about protecting your smile and your satisfaction in the next 10, 15, 20 years from now. Same goes for you. Before you agree to veneers, make sure your dentist has clearly explained all possibilities and limitations. Make sure you feel heard and understood. Remember, the smartest decision may be to wait or adjust your plan, not just move forward. Because the end goal isn't just a beautiful smile. It's achieving a smile that you love, a smile that lasts, and a smile that feels completely you. And you can't achieve that goal if you rush into things. Veneers aren't something you get done and then forget about. They live in your mouth every single day. They deal with chewing, talking, coffee, wine, stress, and for some people, grinding or clenching at night. If those things aren't addressed, even beautifully done veneers can wear down faster than they should. See, when veneers are treated like a one-time cosmetic procedure, their lifespan gets shorter, chips happen, edges wear down, gums change, and suddenly, a smile that should have lasted decades needs fixes far sooner than expected. But on the flip side, when veneers are treated like a long-term investment, complete with proper care, protection, and regular checkups, they can look their best and function comfortably for many, many years. Veneers are a lifelong commitment. So before you say yes to the procedure, it's important to understand how to protect them, how often they need to be checked, what habits you need to avoid to increase their lifespan, and what your long-term plan should look like. Don't worry, when you book a consultation with us, I'll be sure to answer all your questions so you can keep your veneers looking fresh for as long as possible. And being in this business for almost 2 decades, I see the pattern. Most veneer disasters follow the same path. They start too fast, they skip steps, and they ignore the long-term picture. The thing is, great veneers aren't rushed, and I can't stress this enough. They're planned, communicated, and designed with intention. So if you're thinking about veneers and you're taking the time to learn, ask questions, and do this the right way, you're already on the right path. So at this point, you know exactly what goes wrong and why veneers fail. But knowing what not to do is only half the battle. The real question is, what does the right process actually look like? Because there's a specific system, a step-by-step method that creates veneers no one can notice. And understanding that process is what separates people who avoid mistakes from people who get truly undetectable results. So watch this next video where I break down the exact process I use to make veneers that look completely natural. It's right here.